I'm the Chief Medical Officer at HelloMD, and I have a little bit of a prepared speech. Listening to Carrie talk, and she mentioned community and passion. And that's two things that in our company is why we started it in the first place. And I'll just talk about how we started it and why we started it. And it started in March of 2015 doing telehealth evaluations. And up until then, you weren't able to do any type of telehealth evaluation until October, when the Medical Board of California changed their requirements where you could use telehealth platform using your smartphone, computer, anything with a video camera to be able to talk to one of our physicians anywhere in California. So it opened the access to thousands and thousands of patients who had no access before. Because before you'd have to go into an office, drive, etc., and no one wanted to do that. And up until from March of then to now, we have about 85,000 people who've registered and issued about 27 or so thousand recommendations for cannabis in California. So let me tell you a little bit about HelloMD and how and why we started. Now, this is Dave, okay? Now, Dave is always going to be a part of the cannabis community, and he's going to be in the marketplace probably forever. But when we started HelloMD, we realized that things were happening a lot differently and reaching many, many more people than the Daves. And so we started seeing that more and more people were moving towards a different demographic, a different type of person, and for different reasons than the Daves. So we're going to leave Dave locked in the couch and move on to who we're talking about taking care of and giving the recommendations for. And this essentially is the future of cannabis use. People who have specific medical conditions, whatever they may be, in age groups that go far beyond the Daves. So it's everyday people like you, and everyday people like Carrie. Anyone who has a medical condition is starting to use cannabis to help treat that because they want to feel better about themselves without using any kind of medication other than cannabis. And so we said, how are they going to start? How are the people going to get involved in the whole cannabis world to begin with? And that's essentially how we started with our physicians. So we have now 27, well, we have people that call in from anywhere in California, talk to our physicians. We have 26 now that have their medical license. You talk to them for 15 or 20 minutes. And if they issue you a recommendation, you can download it right then and go to a dispensary to use it, or it gets mailed to you in 2 or 3 days with the gold seal on it, and you go into your dispensary then. And I'll talk in a second about how it's even easier to do that. So, but we started figuring, well, okay, now I have my recommendation, now what do I do? What do I get? What's going to be good for my condition? How do I use it? What do I use? Where can I find it? So we said, well, let's figure this out. And what we did was we asked the question, we said, let's do answers. And that's what our platform is for on our site, whereby anyone in any part of the world really can ask a question on answers. And not only will medical professionals answer it, but anyone can answer it. You can answer it. Anyone who's used cannabis in the past can answer the question. It could be a vendor, it could be a distribution person, it could be someone who does deliveries. Anyone at all can answer the question. And so when they're figuring that out, we said, well, let's do it a lot more encompassingly than that. So not only can the vendors answer it, but what happens is the community answers it. So you were mentioning community. So patients get together and they say, listen, I have X, I have insomnia. What am I going to use for my insomnia? Someone can get on and say, hey, I've tried this. I've used it for 5 years. My sister tries it. My daughter tries it. Why don't you try this? And not only that, but things are different in different parts of the country. So someone in New York can ask a question when they can't use vaporizers or smoke anything there, but they can use tinctures. So I'm in New York, what type of tincture can I use? Someone from New York would be able to answer that question for them and be able to get it. Where do I get it? Well, you can get it at this dispensary because they carry it. And so that type of a community is what we're building with answers. And we have trusted brands and realtors that are able to do that too. And we're able to connect them with all our different partners. So someone like Octavia would be on our site, they could answer a question. You can answer the question and they can say, Octavia says, we have this type of product. They can push on Octavia, go to their site and be able to purchase their product right there. If they're on Octavia's site or anybody else's site, they'll be able to say, I don't have a recommendation, how can I get one? Well, on their site is embedded, click here to visit with a physician. They go to our site, we do the recommendation, if appropriately give them the recommendation. It goes back to their site to purchase something. We don't sell anything on HelloMD. We want to be the community where people can integrate and to talk to each other about their passion, about what it is that they like about cannabis and how it helps them for their specific medical condition. So essentially what this is leaving us is that HelloMD is really the center of the conversation for the ecosystem that's surrounding cannabis. You can get answers from medical healthcare professionals, wellness consultants, manufacturers, retailers, anyone at all that wants to answer the question can build the community through answers. So there'll be a community of people that say, yeah, I have irritable bowel syndrome, let's click on that. All the answers having to do with that come up. And so people can talk to each other essentially on the site depending on what condition it is that they have. So it brings the passion that everybody has for their condition, because I'll tell you, after many years of practicing medicine, there's nothing that people like doing more than talking about their medical history. They talk about it, they love talking about it, but more importantly, they like talking about what helped them. So they say, yeah, this helped me. I had this, I took this, and you know what? It worked. And so people listen to their physicians, but more importantly, they listen to other patients. And so that is the community that we're building quite rapidly now in terms of having people communicate on our site. So yes, they are going to issue more licenses for people to grow cannabis. Instead of the only place right now you can do it is University of Mississippi. And through NIDA, is the National Institute of Drug, they are the ones that issue the licenses to everybody. So what the FDA said is, we're going to issue it to a lot of other places. Well, what's going to happen is they still have to get their licenses and research approved by the government. Then they still have to grow the cannabis. Then they still have to do the study. So something like this may, in fact, be some good 3 to 5 years down the line. So unless it gets decriminalized altogether or descheduled altogether. And another misconception is that, do they have to be a California resident to get a recommendation in California? And the answer is no. Essentially, that's a misinterpretation of the law. And the law really is that you just have to physically be in California. So we have patients that would come through, they're visiting, they live in another state, but we can see from their ISP address when they come on that they're physically in California. And the only kicker comes in, of course, is sometimes they'll go to a dispensary with our recommendation, and the dispensary erroneously says, well, show me your California ID, even though they don't really have to. So our partners, whether it be delivery services or whomever, or shipping people, are tied into us so that's completely eliminated. So someone could go to one of our partners, get their recommendation, go back to the partner, and they could ship them, if it's in California, their cannabis. We get asked, can I get this? Can I get this? Will my employer find out? Nobody finds out anything unless you decide to tell them.
What are we doing?
It is completely, what is HIPAA? Okay, the Health Information and Portability Accessibility Act. It's a huge name. And what it does essentially is guarantee, as far as the government can guarantee anything, that your medical records don't get discussed with anybody. And so this is all completely private. Only you and your physician know you saw a doctor, what the medical records show, etc. We have about now 27,000 recommendations, and that's since March of 2015. But our database of patients is now about 85,000 because it's all over the country. People want information. And we have plans to, of course, extend. Unfortunately, California is the only state that allows telehealth evaluation. So every other state in the country essentially restricts access, which is how we look at it, because only people, like in New York, there's only 5 places that people can go to get licenses. So you can't find a doctor, or you can't find them in one state or another, and eventually, and doctors also, quite frankly, are afraid of the FDA because it still is federally illegal substance. So in California, the FDA could come in tomorrow and harass every physician. That's not what they're trying to do right now. So the passion that we have is essentially what's driving the community to be formed, and that's what HelloMD is all about.